Hello, my name is Dr. Raja Adnan Ahmed, and I am a consultant psychiatrist currently working in UK. And with me is Dr. Wajia Zia, who's also a psychiatrist currently working in UK in Manchester. A lot of IMGs ask me that what are my career chances if I pass my membership exam outside UK, and what level can I come and join the training in? So I thought it will be fruitful if we can have example from Dr. Zia, who actually came to UK after passing her MRC Psych in Ireland, and now she's currently working as an ST4 doctor in General Adult Psychiatry in Manchester. So, Dr. Zia, how are you?
I'm good, thank you.
So, for everybody's knowledge, we just like to know, how did you find doing MRC Psych while you were working outside UK in Ireland?
So, first of all, thank you for inviting me. In terms of the question you've asked, so MRC Psych, for example, if you are talking about the theory exam, so it's the same all around the world, okay? Because you have test center, and that's basically you have to read and do the MCQs. That's about the theory test. But for the CASC exam, I think people who are working in the English speaking country, they have a bit of edge as compared to people who have different language in their country, because they have to understand the lingo, they have to understand the ethics. So for me, working in Ireland and giving UK exam wasn't difficult, because I was sort of in their system in a way. But but what I think is, and this is message for all the IMGs, that wherever in the world you are, you can still do the CASC exam, because a lot of IMGs from other part of world who are not from English speaking country also do the exam. Yes, it might take a lot of effort and might take a lot of practice, and I've seen a lot of people getting successful in the CASC exam as well. But again, you need a lot of practice, and the more you practice, the more luckier you get in passing this exam. So that's my comment on how I found doing MRC Psych while staying in Ireland.
So obviously, after you pass your MRC Psych, yeah, there is a route to GMC registration. You can pass your English exam and you get your GMC registration. And the next
Yes.
question is that which level a person can start in. So you started your first job in UK was as an ST4 doctor. You
Doctor.
applied for the ST training. So how was
Yes.
that experience, and how did you go about that?
Okay. So before going on to ST4, can I clear one thing about the GMC registration? So people can get GMC registration on postgrad qualification for MRC Psych, but they have to do an English exam if they cannot get, because if they are working in a country where English is not the first language, they have to do OET or IELTS. But if they are working in an English speaking country, they can get an English reference from their supervisor. So there are two routes to that. So once I got my GMC, of course, I had looked into applying for ST4. So I applied for ST4 in 2019 Feb, just writing my date so I don't mix up. But I've looked into the procedure a year ago. When I say I looked into the procedure, so I looked at the forms, what I need to fill, what evidence I need, and I'm going to just discuss about that in detail. And what kind of ILOs is intended learning outcomes I need for applying for ST4 training. So the first thing is that everybody who's applying for ST4 have to look at the C certificate. That's the form on Oriel account. So if you make an account on Oriel, you will find a C certificate form, which actually tells you what evidence are they looking for in an ST trainee. So I think you're going to share this form on
I
the.
will share the form, and this form is also called the core competencies form. So it
Yeah.
basically means that you are giving evidence that you have completed the core competencies required for
Yeah.
an ST training.
Yeah, so basically, after the initial biodata, they ask for psychotherapy competency, professional competency, clinical competency. They look for research, they look for team working, they look for all the evidence what they require. And so whilst you're filling that form, you also need evidence to back up whatever your supervisor is filling for you. So for example, we have something called as work-based place assessment. So for that, we need to have a form starting from clinical work to research, audit, teaching experience, psychotherapy experience. You need to have all this in a written form or electronic form, however you do it in your country. So what I did in Ireland, we have a number of forms. So I used Irish forms as well, even though, it's a different kind of form, but they sort of keep it as an evidence to your CT competencies for ST post. So ILOs and having evidence is very important, because when I sat in my ST4 interview, they have looked for everything specifically. So if you are saying that you have managed a clinical rota, there should be evidence for it, whether it should be in your letter of recommendation or whether it's your managerial experience in a WPBA. So this is very important. And in terms of psychotherapy, what I've done, of course, many systems are different. In UK, you have a lot of opportunity to get psychotherapy experience. So what I did is I did a postgrad certificate in CBT, and I've picked up 2 cases, which comprises for my short therapy cases. And then I did a course on DBT online. And then I did a DBT, I picked up a DBT session, and my supervisor was my psychotherapist in the team. So that have filled in my competencies for psychotherapy for my ST post. These are the 2 things I want to mention. And other than that, there's person specification form. You can have a look at that. It actually entails what they're looking for in an ST job or ST person who is applying for this job. And there's one more form which is called a self-assessment form. These are all on Oriel, so nothing to worry about. So then what they're looking for, that how do you mark yourself? And they will actually, and there is a section in the ST4 interview that they will ask you, how did you mark yourself? And they will tell you those numbers. And if you have sort of marked yourself less, because I did not give myself credit for the postgrad certificate in CBT, so I got extra marks on that. So, and if you have given yourself marks, I suppose more marks by mistake, or probably didn't understand, then those marks will reduce. So they'll just try to tell you everything what you have done. So these are the 3 things you need to apply. You need to look at least a year ago, before you start applying for the ST4 applications.
So you're saying while you are doing the MRC Psych exam, it's a good idea to look at the person specification for ST4 and see if you can tick those boxes and start gathering the evidence, and also start making a file or a portfolio where you can gather all the evidence, so you have that ready when you're applying for your ST4 post.
Definitely.
And you also explained something about the interview, that when you go for interviews, you are actually self-ranking yourself. They will ask you to rank yourself against the person's specification, and that form would be in front of you at the interview. And then you would have to give them the evidence that if you have said you have done something, that you really have done that. And based on that, they can rank you higher or lower than the other candidates.
Yeah. So that's called a self-assessment form. And then there's second called person specification. And the third form is CSAT. I know there are 3 forms, but have a look at them. They can be quite daunting in the beginning, that, oh my God, how I'm going to collect all the evidence. But trust me, 1 year, you can collect all the data, plus you can get some retrospective collection of the evidence as well. What I've done is, so I have collected data over my evidence for over 1 year, but then I have done teaching beforehand, and my consultant evidenced it on the WPAs. So it's nothing to be scared about. It's about the clinical work you do every day. So it's just that jotting it down on the forms now. So you can collect data prospectively, but also retrospectively. Depends on your supervisor and how you get on with them.
And the next question I want to ask you, that how do you find life in the UK in general, and also as an ST doctor? Are you enjoying this stay here and the training you're getting here?
Okay, so let's begin with the ST doctor in UK. So when I started, so I work with the team, which is CMHT, which is basically inpatient and outpatient combined job. And I suppose my starting as an ST doctor, I first had I had to do Mental Health Act training because that is needed while you work as an ST doctor. So this is something I was proactive about. I guess before coming here, I was curious and a bit apprehensive about how will I get about things. So you need to learn about the system before you start, just so your supervisor know that you're trying. So I did my Mental Health Act assessment course before even I started my ST job in August. So when I started my job, I told my supervisor, honestly, what are my limitations as to on calls and everything, because you need your mental health assessment and training for your on calls especially. So my supervisor was very good. He was very understanding of that. And then once, in terms of my clinical work, I think what I can say is working in Ireland, working in UK is not different, because psychiatry is not different. It's just the legislation you need to understand about. And I think I'm open enough to ask if I'm having a wobble or if I'm struggling about understanding the nitty-gritty of the legislation. So I think in general, I enjoy working here. I got a lot of opportunity for teaching as well. Now I'm also doing a postgrad certificate in work in medical education, which is funded by the Northwest Deanery. So that's one thing very good. And then, of course, doing courses, attending the ST training days, that increases your knowledge, at least as you progress in your work. And recently I got my ARCP, which is basically annual review of your clinical practice. So I got outcome 1, which basically says I'm progressing at my good level, at the expected level. So I'm enjoying my ST job. In terms of life in UK, so of course we are in a lockdown at this stage, so I couldn't go many places. But before the lockdown, I've sort of explored a lot of places within Manchester. So it's really good. I like the life over here. It's different from Ireland, of course, but again, I really liked it over here. So I'm enjoying my life in general as well.
All right. Thank you very much, Vajia, for your time. And I just want to say, Vajia has also written some blogs which are read now thousands of times, which include her experience of doing MRC Psych and then her experience of getting the ST training as well. And I will put the links with this video as well if you want to read that. But you can see what Vajia has done is an amazing achievement to complete her MRC Psych while she was working outside UK and came to UK and started working as a ST doctor. And in 2 years' time now, she will be at a level of working as a consultant, hopefully very soon. So Vajia, thank you very much, and all the best for your rest of your training. And I hope you will achieve all your goals.
Thank you very much.